My name is Scott Winkel. I'm a physician assistant with Duke University Hematology Oncology. I am part of the multiple myeloma program. The first time I'd ever done a bone marrow biopsy was almost 20 years ago, and it was overwhelming and nerve-wracking, but you slowly learn over time how to do it and do it proficiently and effectively for the patient. So the greatest concerns for a bone marrow biopsy are really focused in two particular areas. The first area is the safety of the patient. The second is that we're doing it for diagnostic purposes. I transitioned over to the OnControl device in a relatively unique way. It came out of patient request. The patients, they actually are very skilled at talking with each other, and they were the ones that said, I want this procedure and I want this device. And when that started happening, again, putting the patient's needs first, we started to become more adaptive of it. The improvement in the sample quality using the OnControl is really in the size of the core. Speed of the procedure using the OnControl versus the manual needle it's really unparalleled. It happens so quickly that the technicians have a hard time keeping up with us. I don't feel like using the device you sacrifice safety in terms of the quickness. Initially, when it was proposed to us, I was a bit reluctant because it's new technology, and anything new is intimidating and takes time to adapt to. However, once I started to use it and get the feedback from the patients were telling me that it was their preference, and so that's what I needed to hear. And the group that came over and showed us did a great job of explaining how to use it, the appropriate technique, and have provided us with the appropriate resources. So it really wasn't that difficult. These patients inherently, from the minute they walk into that room, are struggling with a diagnosis that they don't want to deal with, and that it's overwhelming, it's life-altering, it's scary, it puts everything into perspective. And so these thoughts and emotions are coming to them at baseline, and everybody tells them it's the worst experience they've ever had, and it really just puts them in a frenetic state. And I see it every day. Me as a proceduralist and a provider, the best thing that I can tell that or get from that patient is for them at the end of the procedure to say, that is not as bad as I thought. And then I feel like I've done my job. So that's kind of the gold standard. I'm a bit reluctant to try new things, even though I like new technology and I like toys, because it requires me as an operator to relearn a skill set. But it's really the patients, and when the patients request it, I'll do my best to test it out and try it for their needs, because that's who I'm doing it for.